I'm Claudine Wong, joining you from the San Francisco Bay Area, and I'm joined now by Dorian Spence, who is the Director of Special Litigation and Advocacy, Lawyers Committee for Civil Rights Under Law. Thanks for joining us.
Absolutely. Thank you for having me on.
So let's talk about the big issue that you are focused on right now, and that is how COVID-19 is really disproportionately affecting the African American community and just communities with people of color in them. It is something we know. There's not a lot we know about coronavirus, or as much as we want to know about coronavirus, but we do know that. I know I saw just a few articles just out this morning that talks about in various states from Louisiana to Chicago to North Carolina to Wisconsin, that we know they're saying that the people who are dying, the fatalities especially, are disproportionately affecting the African American community, and that's a very concerning issue that's coming up.
No, absolutely. We issued a call to the Department of Health and Human Services yesterday, and specifically to the sub-agency of the CDC to release what data they do have. And what we know is that the case report form that's created by the CDC asks for race, gender, sex, age, and location. So for all positive tests, or for tests that are conducted, this is, and for positive cases, this information is supposed to be elevated to the CDC. To date, the CDC has not made this information public. And to inform advocates like myself, people in the community, as well as state health departments in
why do you think that's happening? I mean, if it is the data there, or I mean, certainly this virus and this pandemic has overwhelmed so many different institutions as we try to just wrap our brains and our hands around it and make sure that there's enough treatment options and enough ventilators to go around. Why is this data? Is it just making it hard? There's not enough people to get the data out?
Well, we don't know. But what we do know is that there is a responsibility to make sure that the communities that are being hardest hit get the resources that they need, whether that be testing or treatment, right? And if we see out of a city like New Orleans, or a state like Louisiana or Illinois, where the population is 14.6% African American, and 28% of the people dying or tested positive for COVID-19, then there's a problem with the plan that's being implemented to respond to this pandemic. One other thing that we know just from these numbers is that this pandemic knows no race, right? It prefers no gender, it prefers no sex. If you're around it, you're gonna get it, right? That's why we've been instructed to stay at home and to socially distance. But if we're not putting the resources in the right communities, then we'll see communities spread hop from one side of the town to another side of town. So it would be best for everybody if we made sure that the folks, that people in all communities are getting tested and treated as they should.
Well, let's talk specifically about this letter. I can see if I can pull it up so we can take a look at it and just kind of get it in a full view. Let me see if I can pull it up full so we can see it. How's that?
Right, no, absolutely.
So let's take a look at this letter and what specifically you're asking the Department of Health and Human Services and what you want. I mean, it is numbers at this point. And it is talking about resources as well. So it's numbers of who's affected, it's knowing who's affected, and then it's getting people the care they need in areas that they may not have the resources that other communities have. Correct?
Absolutely. And we know that they have some data on who's being affected and who's not, but it hasn't been made publicly available. To actually put this in perspective, there was an article released on ProPublica, I want to say it was last week, and it specifically addressed what the CDC normally does when there's some type of widespread issue as far as public health is concerned. They typically make these numbers available. Now, we've been in the throes of this pandemic for, on the lighter side, 3 weeks, but I think the first diagnosed case in this country was back in January. So we knew that this was coming, and it's been a world health issue for no less than 3 months and some change at this point. So we know that this pandemic is affecting some segment of the population. It would be great to know where those numbers are coming down on. Are they skewed along racial, ethnic lines? Are they skewed along gender lines? Or we know that men are more susceptible to being diagnosed and dying than women, but it would be great to know this information about race as well.
So yeah, and I
Specifically,
mean, these are the two reasons, right, that you highlight in the letter to better inform,
right.
to ensure that tests are not being administered or withheld in a racially discriminatory manner. Do you think that's actually happening, or is that just something you want to make sure doesn't happen?
No, absolutely. We want to make sure that it does not happen. But also, to when we talk about the distribution of resources, right? If you take a city like Washington D.C. and you say we're going to place an emergency response facility in the middle of the Washington Mall, right?
Yep.
But we know that from the numbers and the data that African Americans are disproportionately affected by this particular disease, but they may not have access to the middle of the Washington Mall, right, because of transportation issues. You might want to think about putting that facility somewhere else, right? If certain communities are being affected by this pandemic more so than others, right?
So it seems like that would be a good place just because it's in the center and it's a well-known place, but if that's not the place that really meets the need, then put it somewhere else.
Exactly. We're talking about the distribution of resources, testing, and treatment. And we want to make sure that that's not happening. But what we do know, like I said, in the data that has been released for places like Illinois, at the very, very local level, Milwaukee County or Michigan or North Carolina or South Carolina, that those numbers are skewing higher in minority communities.
Yeah,
and then
so
when you talk
those
about
are the people, really quickly, Dorian, who again, I mean, you mentioned that ProPublica article, and simply because we have it up here on the screen and people can take a look at it, let's talk about those numbers again. This was from April 3rd. You said Milwaukee County population 26% Black African Americans currently comprise almost half of the county's 941 cases, 81% of its 27 deaths. And you mentioned Michigan, 14% is the Black population in the state of Michigan, but 34% of the cases, 40% of the deaths. And then North Carolina, 22%, but 36% of the cases and 25% of the deaths. So we do have some data to work with and to give a basis of obviously concern.
Absolutely. And what is curious about those numbers is that those numbers come from the state public health departments, or in Milwaukee County, the local public health department, right? So you have some states that are reporting on this information. And in addition to the letter that we sent to HHS yesterday, or the Department of Health and Human Services yesterday, we also sent out letters to all 50 state health departments, as well as the District of Columbia, asking for them to make public these numbers as well, right? So to the degree that the CDC does not want to release this aggregate data, we would like the states to do their part to make sure that they're employing resources in a way that's equitable, in a way that makes sense to the communities that are hardest hit by this virus. And there's one other piece to this as well. When you talk about some of the health issues that African Americans tend to contract, whether it be heart disease or respiratory issues, asthma, these are health issues that, and you have it up on the screen, these are issues that actually
following right along
work in tandem, right, with COVID-19 and actually exacerbate some of the issues that pop up from the virus. So we talk about like segments of the population that are more susceptible to dying from this particular virus. Black and people in other communities of color are right in line with that. We just want to make sure that there's an adequate health response.
Yeah, it is interesting, as you know, I was going through your letter and taking a look at some of the issues, because it is the health outcomes and the higher rates of what you're talking about between asthma and diabetes. Then you also mentioned, you know, in this next paragraph, which I thought was interesting too, and I wanted to talk about that too, is only 20% of Black workers able to work from home, while almost a third of their white counterparts can do so. That is an interesting discussion as well, because that ability to protect ourselves, the ability to do what you and I are both doing right now, and working from home and being able to shelter in place, that also, and there's been a lot of reporting on the privilege of being able to shelter in place and how it disproportionately affects socioeconomic communities and ethnic communities.
Absolutely. I mean, when you talk about the other 80% of Black workers who can't shelter in place and work from home, that segment or proportion of the Black community either lost their job, right, where they don't have access to health insurance, or they don't have easy access to testing because they can't pay out of pocket, right? Or the essential workers, right, where they still have to go out and expose themselves to this particular virus. So it has a detrimental effect either way. But this is a vulnerable population. And, the letter was signed on to by over 400 medical professionals.
Yeah,
And
that's the
actually,
other
and I
part.
have
Yeah,
to tip,
I looked at mostly doctors. Is that who you were trying to get to kind of be a part of this, to take a
right,
look at, and was that hard? I mean, when taking a look back at the letter, and you can see people from San Francisco to Tennessee and Georgia, and I mean, how did you track down these doctors? Who are they? And, are they in specific specialties? Are they just part
right.
of the group? I mean, how did you get a hold of the people that you had signed this?
Right. So when you ask, was it hard? I mean, it was difficult, yes. But when you raise the issue to medical practitioners and people in the medical profession, they recognize immediately that this is data that needs to come out. This advocacy was actually started by the first people to ask the question was a small group of doctors out of the University of Virginia as well as the city of Atlanta. And they asked maybe 10 weeks ago just a public plea to the CDC for this data. And we had our first conversation with them not too long after they made that initial ask. And this issue has been bubbling up across the country. You had Uche Blackstock, who was on our press call just yesterday, and she raised the same issue out of New York, and she's been making public calls on Twitter for the same information. So once we rolled out the idea that this needs to be a public plea to the CDC and DHS, we had no shortage of doctors who were more than willing to sign on to the letter and to stand united with us making this call to the federal government as well as state health departments and agencies.
So I guess the question is, have you heard anything back? I mean, are you hearing from Health and Human Services at all saying, yeah, you know what, we either are going to get you this data or we're going to release this data publicly for everyone? Or if they're saying, you know what, we would love to, we're just overwhelmed. This is not a purposeful thing. And this is just, we are trying to do the best in a very difficult situation. Which, are you getting any response?
Nothing. It's been 24 hours. We have heard nothing. And, with this administration, when you reach out and you ask hard questions like this about where, when we're dealing with life and death, and asking these questions along racial lines, I would expect to hear something back in a reasonable time frame. But given how fast that this pandemic is moving, and we're talking about the numbers of life and death and diagnoses every day, I would expect to hear something by now. At least I got your email and we're working on it, but we haven't heard anything.
You haven't gotten any correspondence whatsoever?
No correspondence from the Department
What
of
do
Health
you
and Human
think would be a reasonable, if not that, for them to, I mean, it's a lot of data being collected, and I'm not sure if it's being streamlined, right? That maybe states are the best place for them to keep an eye on it because the numbers are changing so quickly. I mean,
Sure.
is there a problem? Because if states are doing their own response, right, in large part of deciding where their testing centers are and where, where to best put their resources, then aren't the state's numbers maybe the best place to have it? Does it have to be from the Department of Health and Human Services, or the numbers we're getting maybe give us an accurate picture as it is? And as long as the governors or whoever is deciding how the states issue their care have those numbers, then everyone's doing the best they can. Does it have to be from the federal level that we get this information?
Sure. No, I think Illinois did a fantastic job of releasing the numbers as they should for medical practitioners to run the analysis, right? Same thing with South Carolina. They make their numbers public. But I think to get an accurate depiction of what's happening across the country, the CDC should release their numbers as well, in tandem or in partnership with the states. I think all of this information should be publicly available. For example, Sunday, we did a 50-state survey going through, and the District of Columbia, going through each and every Department of Health website at the state level. And we know that at the very least, each of these places is tracking testing as well as deaths along the lines of age, sex, and for the vast majority of them, broken down by county, right? Race is the last box that they have not released. So the data's out there. We know it's out there. But some states, the vast majority of states, just haven't released this information. But we think that it should be released both at the federal level and at the local level, which is the reason why we took the letters yesterday.
Yes. Is there going to be an effort then to also, for the states who aren't releasing the information, to go on the state level, push for it, and on the federal level. I mean, really, at this point, for medical professionals and for anyone trying to get their, in this fight against Corona, the more information is the better. So if they come from the states, if they come from the feds, I mean, there will be a time certainly to go back and say, why wasn't this information out there? There's the short term and the long term, right?
Sure, no, absolutely. And believe it or not, we received correspondence back from some of the states that we reached out to yesterday as well. So we are pushing states to release this information. We want to give them some time to respond. It's been 24 hours. We've heard back from some. The other ones that we haven't heard back from, we plan to tap in with to see if they'll make their data public, or at least create a dashboard on their COVID-19 websites. In the letter that we sent to HHS, I believe we asked for an immediate response, but for written correspondence by April 20th with a plan of action. But we also urged them to coordinate with every agency that they can to make this data public on a daily basis, because it's that important.
Are you getting any help and support from other lawmakers? I mean, you can send the direct letter. You can also reach out to various members of Congress, right, who may have the ability to pull even harder for information. Are you getting support from lawmakers?
Sure. Senators Elizabeth Warren, Senator Cory Booker, and Senator Kamala Harris, as well as Representative Ayanna Pressley and Representative Underwood, released a letter a couple of days before ours asking for something similar. And they are in tune with this issue as well. Representative Andrea Ocasio-Cortez has been making a lot of noise about this as well. So every day this thing is gaining steam. And as we are looking as a country to push back against Corona, I think we cannot leave out of the conversation marginalized communities, and which are largely communities of color. Because once again, making this point one more time, you can look at this and treat one side of the city, but if there's community spread on the other side of the city, this virus knows no race, it knows no bounds. If you come into contact with it, you're going to get it. So you have to treat the entire city. You have to treat the entire population, all segments of the population, because community spread is real.
Yes, it is. It is a very scary time we live in, and are you, I guess, hopeful then, with all these all the different branches reaching out, the states reporting, and the responses that you're getting, in terms of a timeline? How hopeful are you that you're going to get the information that you need in a time? Obviously, sooner is better, and obviously, if more people respond, that's better. But given the numbers that we are seeing, given the responses that you are getting, are you confident that this is something that will move forward in terms of getting more information?
Working in this field, we understand that sometimes the deck is stacked against you, but it doesn't mean you don't fight. So if we don't get it in a reasonable amount of time, we're going to fight to the end to make sure we get what we need as far as data is concerned to keep our community safe. Because
what would be a next step then? If you don't hear anything by April 20th, what's the next move?
Well, we also issued a FOIA request, a request under the Freedom of Information Act, which is a federal law that you can request information through. We have to give them a reasonable time to respond to that, but we have to make sure that we get this data, at least a snapshot, which is the reason why we filed the FOIA as well.
Okay. All
right.
right.
And if we don't get a response to the FOIA, we have to follow those steps out to make sure we get the information that we need.
Yep. All right. Well, Dorian Spence, Director of Special Litigation and Advocacy Lawyers, Committee for Civil Rights Under Law. That is a long title, but a big one. So
long title and a long name. Thank you for having me.
Long title and long name, but thank you for the work that you're doing. It's important information. The more information, the better for this fight against COVID-19, for sure. All right.
Absolutely.
Thanks for joining us. And we'll have more information, of course, on our website at coronavirusnow.com. Thanks for tuning in.